Hello there, Dr. Kessler here once again. In today's video, we will talk about ultrasound probes. I had earlier introduced you to the ultrasound machine, so today we'll talk about ultrasound probes. We have some of them here. So what are ultrasound probes? So ultrasound probes or transducers, they are the tools that we use for scanning, right? The ultrasound probe is that part of the machine that you actually place on the patient to acquire your images. And you are able to do that because, like we said, the ultrasound probe contains piezoelectric materials. What are piezoelectric materials? We'll discuss that, so check your notes. So the probes contain piezoelectric materials, which, when they are activated by electricity, give out ultrasound. And then these ultrasound, when they meet tissue interfaces, some sounds are reflected, some are transmitted, and what have you. Those that are brought back, those that are returned to the probe are converted by these transducers to electric signals, which are then converted to images by the ultrasound machine. Now, every probe, every transducer has a footprint. The footprint of the probe is that part of the probe that is in contact with the patient's skin. This probe has a footprint. Similarly, the footprint, every probe has a footprint. Now, within the probe then is the piezoelectric materials. Then behind the piezoelectric materials, we can see that is a backing layer, then the wire, and then the casing that covers it. Right, all these are in your study materials and your books. You can read them up. Now, let's talk about the types of probe. Now, probes are classified variously. Some probes are classified based on, are they manual or electronic probes? Manual probes are they're obsolete now, so we're using electronic probes. Probes are classified based on their shapes, based on frequency. So based on their shapes, we have the curvilinear probe. And the classification we're going to use today is based on the shapes, and then I'll tell you the frequencies that are contained within these probes. Now we have the curvilinear probe. Curvilinear because of the shape. Okay, this is the curvilinear probe, and it is mostly used for abdominal scans, obstetric scans, and the probe frequency is usually between 2.5 to 5. I have seen some that are up to 6. What that means is that they are multi-frequency probes. Okay, so that's the curvilinear probe. And the curvilinear probe on the monitor will give this form of outline. That's the shape that you see on the screen. Okay, with the curvilinear probe, you have this trapezoid outline with a curved upper border. So when I see this field of view without looking at the type of probe, I already know that a curvilinear probe is activated. So one type of probe you must know, and we use it quite a lot, is the curvilinear probe for our abdominal scans, pelvic scans, obstetric scans. Right. Now the next probe we want to talk about is the linear probe. The linear probe, just like the curvilinear probe, of course, has its footprints, and what have you. Every probe, I must say, every probe has a marker, an orientation marker. Okay, the curvilinear probe also has it. We will demonstrate the utility of the um, orientation marker in the practical class that shows you where you are when you are scanning. Okay, for now, the curvilinear probe is used for superficial scans. So that is the scan we use for our ocular scans, thyroid scan, breast scan, uh, scrotal scans, soft tissue scans. That's the curvilinear probe. It is considered a high frequency probe because the frequency of this probe is usually from 7.5 megahertz and above. In contrast to the curvilinear probe that usually has frequencies from between 2.5 megahertz on 2 megahertz to about 5 6 megahertz. Okay, so the linear probe is a high frequency probe. What that means is that it has very good resolution when you're using it, but the penetration is low. If you remember the ultrasound physics, the ultrasound formula V is equal to, as velocity is equal to frequency times, velocity is equal to frequency times wavelength. So if you remember that formula, you understand that as you increase the frequency, you have a higher resolution, okay, but the depth is reduced. I mean yes, how deep it can stand reduces, right? Okay, now we want to talk about the phased array probe or the cardiac probe. From the name, you can see it is a probe that is mostly used in cardiology because of its small footprint. And this footprint is small so that it can fit into intercostal spaces during echocardiography. There's also the probe that is used sometimes for doing transcranial ultrasound. Okay, so it is a very important probe, and the frequency is usually from 2.5 megahertz to about 4.5 megahertz. Okay, and when okay, let me just do this, then I'll double back. When we activate the cardiac probe on the machine, you see that it has a trapezoid shape but with a sharp upper border, unlike the curvilinear probe. And when we activate the linear probe, we have a field of view that is rectangular in shape. So this is important for those that are going for practical exams, and you can be asked this question. Now let's talk about endocavity probes. Endocavity probes are probes that are put inside the body. So in transesophageal echo, we have an endocavity probe that is put into the esophagus. But for transvaginal transrectal ultrasound, we have the transrectal probe. And this is this is an endocavity probe which we can use for transvaginal and transrectal ultrasound. Strictly speaking, they are not the same, but practically, where you have this probe, you can also use it for transrectal scans. So, strictly, this is a transvaginal ultrasound probe. The frequency is usually from 7.5 megahertz and above, some get up to 12 megahertz. Okay, so it is used for transvaginal ultrasound. In the practical class, we are going to demonstrate probe handling, probe movement, how to use these probes to acquire optimal images. So for now, what I have said in summary is There are different types of probes. We have the curvilinear probe, we have the linear probe, we have the phased array or cardiac probe, then we have the transvaginal probe. Thanks for listening. Have a lovely day.